Good morning, ladies and gentlemen. Welcome to day two of the Global Healthcare Unity Summit on COVID Unity. This has been created by Voice of Healthcare and the Times of India. Voice of Healthcare is a nodal body and visionary think tank for policy advocacy, idea mobilization, and sustainable advancement in healthcare. Times of India, as you all know, is India's largest circulated newspaper, and it prides itself in leading conversations that initiate social change and policy changes as well in arenas which, of course, matter the most for the Indian public. I would like to also mention our country partners at this summit, Great Britain and Northern Ireland, Israel and Taiwan. Associate partners, Dr. Wilmer Schwab, India, educational partner, Chitkara University, well-wishers, Vadia Hospitals, and knowledge partner, Praxis Global Alliance. I would now ask Dr. Sachin Gupta from Salus to give us the first note on this summit.
Thank you, Priyanka. Good morning, everyone, and welcome to Global Health Unity Summit 2020, being organized by Times of India, Voice of Healthcare. On behalf of organizers, I'd like to extend a warm welcome to special guest Dr. Vrinder Garg, OSD to Union Health Minister, and Dr. Arvind Lal, Chairman, Dr. Lal Path Labs. We'd also like to extend a very warm welcome to all doctors, nurses, and healthcare leaders who are joining us from across the world for this summit today. To all healthcare professionals, you have done an exceptional and untiring job over the last few months, and the entire mankind is indebted towards you for your efforts to help us sail through this humanitarian crisis. We at Voice of Healthcare are committed towards improving access of high quality and affordable healthcare to entire mankind, especially those living at the bottom of the pyramid. This Global Health Unity Summit has been organized in partnership with Times of India and some of the overseas nations like United Kingdom, Taiwan, and Israel to bring together global healthcare stakeholders under one umbrella and to strategize and chalk out a collective action plan for overcoming global healthcare challenges of 21st century. Yesterday, we had some very insightful and interesting discussions on role of healthcare technology and evolution of pharmaceuticals, medical device, and healthcare delivery segments. We also had a insightful discussion on Ayurveda and holistic medicine yesterday. One thing that emerged from yesterday's discussion is that healthcare delivery is going to see a paradigm shift in coming years, especially after the COVID is over. We'll see a lot of digitalization happening, and some of that has already happened. So all of us need to brace for the change which is coming in this industry. Also, there is a pressing need for more and more cross-border collaboration to overcome challenges of 21st century. Today also we have very interesting lineup of sessions, especially on healthcare entrepreneurship, innovations, medtech, and session on diagnostic industry as well. I'd like to thank our global partners, the Great Britain, Taiwan, and Israel, for their contribution in making this summit a great success. Finally, I'd like to thank all the visitors, partners, speakers, healthcare professionals, delegates, guests of honor, and chief guests for their time. Thank you. Thank you so much.
Thank you so much, Dr. Gupta. We would now like to play a recorded message that we have from James C.F. Huang, Chairman of the Taiwan External Trade Development Council. Could we have the video, please?
Ladies and gentlemen, Namaste. I'm honored to join the Global Healthcare Unity Summit together with top leaders and entrepreneurs from Taiwan and India today. As we pass the midpoint of 2020, the world continues to grapple with COVID-19, with confirmed cases surpassing 29 million last week and deaths reaching 931,000. What began as a health crisis has quickly evolved into a social-economic emergency, infiltrating every aspect of our lives. Among the regions more heavily impacted by this epidemic, many countries in the world recently experienced a second wave of outbreaks. When Taiwan's government first picked up on the gravity of this impending crisis as early as January, it was quick to mobilize its industries and bureaus in combating the epidemic. In the initial stages of the outbreak, Taiwan implemented border controls, requisitioned increased mask production with a specialized national team, and developed many technology-based epidemic prevention methods. Taiwan is one of the few countries which have been able to contain the spread of COVID-19 quite effectively. Today, Taiwan has successfully contained the virus domestically, recording less than 500 total cases and single-digit fatalities. However, in the fight against this global pandemic, Taiwan does not stop at caring for its own. More than ever, during these unprecedented times, countries must band together to uplift each other. We wish to share our experience and expertise with those facing virus-induced hardships and offer any needed support. On this front, TAITRA joins in on Taiwan's stride for global citizenship and humanitarian efforts. We launched the Taiwan Anti-COVID-19 Pavilion website, an online platform combining the work of experts from more than 20 medical institutions and 2,000 manufacturing companies specializing in medical devices for epidemic prevention. By integrating the domestic resources for epidemic prevention with our international offices, TAITRA can share Taiwan's experiences and match the supply needs for medical technology and devices. To facilitate more interpersonal aid, in the past months, we have invited experts and scholars from Taiwan's top hospitals to shed light on relevant health issues via webinars, connecting health officials from around the world, including those from India, Southeast Asia, South America, and Africa. In these workshops, doctors have spoken about Taiwan's healthcare system and its response methods to COVID-19 patients. India is our vital partner in terms of economy and trade. TAITRA is not only committed to establishing platforms to share our anti-epidemic experience, but also bridging India and Taiwan together. Through our 64 overseas offices around the world, we believe that we can deal with the challenges of this pandemic and make the world a better place. We hope that this event will be the platform to connect on all fronts with our partners in India. Before I finish, I would like to thank you all for your participation today. I sincerely hope this event will be a great benefit to everyone here. Thank you.
हाँ करवा देंगे
Hello. After the address by James Wang, we are now moving on to Dr. Varinder Garg, who is OST to Union Health Minister and President PGI-MER. Dr. Garg, we would like to hear a few words from you, please.
Thank you, Priyanka. I will first quote our ancient wisdom or Vedas that we as Indian society is always striving for the utmost level of physical and mental health with the social innovation, entrepreneurship. We always strive for the happiness, as rightly mentioned in Rig Veda, Om Sarve Bhavantu Sukhina, Sarve Santu Niramaya, Sarve Bhadrani Pashyantu, Ma Kaschid Dukh Bhag Bhave. Om, may all become happy, may all be healthy, may all see what is auspicious, may no one suffer in any way. Om, peace, peace, peace. So, today, this is the most elusive goal of the human society. After traveling miles on the advancement in the technical and the social and the all the fields of the civic life, the goal of happiness and peace is still elusive to the mankind. So, as the uh, inheritors of the Indian wisdom, we are the people who can jointly work to promote the innovation and the entrepreneurship to achieve the higher goals of the healthy society by social inclusion as well as the inclusion of the all the stakeholders from the research institutes to the startups to the innovators to the entrepreneurs and to the with the established players. So I will also congratulate the Voice of Healthcare and the Times of India by organizing this summit at a crucial moment when humanity is facing the most dreaded challenge on the healthcare front in the form of the corona pandemic. And this is not only a health problem, but the economy is shattering and the socialization, because we human beings are social animal, and the corona pandemic has restricted our social activities, so turning us into an animal only, and that is to endangered species by due to its clinical manifestation. And second, I want to mention is the changed geopolitical situations due to corona pandemic. Dr. Lal is on the panel. Dr. Sachin Gupta is here. Dr. Lal is contributing in a big way in the early detection and diagnosis, which is not only in clinically but in socially, is very necessary element to contain the pandemic. And entrepreneurs like Dr. Sachin, they are working overnight from the online platform to keep the health system running. So, at this time, due to the change geopolitical situation for us, for India, and for our other collaborators, Taiwan, Israel, and UK, it's time to shift the manufacturing base of the medical devices from China to India. As an Indian, I feel Chinese credibility is much more under suspicion these days, and due to our large technical base, so India is the suitable candidate to chip in into the medical devices uh, field, and this will benefit India hugely and also the world hugely in the form of the cheap medical devices. Number two, uplifting the healthcare standards in India. Number three, making Indian and global healthcare systems robust enough to face such challenges in future. Number four, by creating the enormous employment opportunities in India, like in software field, which was a rocket science to Indians till early 90s, and now it is the Indian diaspora which is fueling the engine of the Silicon Valleys all over the world. So I see no reason in the coming 10 years that it will be the Indians, techies and the medicos who will be the fueling of the engine of the medic devices, medtech innovation as well as manufacturing, as well as entrepreneurship globally. So I again repeat our prayer as well as our goal to all. I pray for a healthy life to all the global citizens, and I hope that the voice of healthcare will be mm, contributing in this goal in a bigger way in the coming days. Thank you very much.
Thank you so much, Dr. Garg. We would. That's a really beautiful message from you. And yes, we all do pray for an early end to this pandemic. I would now ask for my special guest, Shi Sin Su, MD, PhD, Medical Secretary from National Cheng Kung University Hospital, Taiwan, for his message to the audience in India and the summit.
Ladies and gentlemen, I'm Xu Zixin from National Cheng Kung University Hospital in Tainan, Taiwan. It's my pleasure to give the opening address of the Global Healthcare Unity Summit. Our government is now promoting the new southbound policies in some areas, such as economic cooperation, people-to-people exchange, resource sharing, and regional links. India is especially marked as a key country, with strong academic, cultural, and economic interactions. There are around 18 master and doctor students in our university, which is about 10% of the international students in our university. This year is the third year NCKUH is trusted to run the medical and the healthy project. Due to the epidemic, all the trouble are stopped. However, the connection are still keep growing when they are co-hosted. COVID-19 pandemic have engulfed the entire world. It has caught many countries unaware. As a result, these countries are finding it hard to control the situation, even as the number of casualties is increasing day by day. In contrast with the international COVID-19 outbreak, Taiwan's condition is relatively more stable. Taiwan has been applauded internationally for quickly and effectively stemming the spread of the virus. Taiwan was ready when the outbreak in Wuhan occurred. After the first notification at the end of 2019, we swiftly deployed a combination of measures to identify and contain the virus, including the use of big data to help contain the potential cases. Big data analytics is being utilized by combined information held by National Health Insurance, National Immigration Agents, and the Center for Disease Control. Medical staff are to see when a patient has been in a high-risk country or he contact with someone who has tested positive for coronavirus. Another one of the key factors is we have highly quality medical professionals and solid experience in combating the pandemic and their own march to the region learned during the SARS outbreak. Taiwan's success to a combination of effort by medical professionals, the government, the private sector, and the society. Also, we must leverage our strength and knowledge to help our country to fight the virus. National Cheng Kung University Hospital is the leading medical center and the best equipped teaching institute in South Taiwan. With more than 5,000 staff, 1,354 beds, it has the mission of providing support in medical education and research, apart from clinical service. In this pandemic, we implemented innovation measures for epidemic prevention, including triage, e-health clinical decision assistant, AI system for X-ray interpretations, EMR, smart bracelet for body temperature monitoring, and the COVID-19 website. A pneumonia detection system developed by a team from National Cheng Kung University was honored in the healthy category of the online COVID-19 Global Hackathon. The system has already been tested by doctors at National Cheng Kung University Hospital, who found it achieved 92% accuracy with real patients. The team is working on incorporation CT scan or MRI to further improve reality. Moreover, we had been proactive in pursuing international cooperation. We co-host a webinar with India, Indonesia, the Philippines, and Kenya to exchange containment experience. More than 10,000 medical personnel are beneficiaries. The particular number of nearly 9,000 of the webinar co-hosted with India is especially a world record. The worldwide spread of COVID-19 have once again shown that disease knows no border and that no gap should exist in the global epidemic prevention network. The collapse of a medical system in any country will not only impact the country, but will aggravate the pandemic worldwide. As a member in the global village, Taiwan has one of the world's top health care systems, strong research capability, and transparent information that we actively share with both the public and the international bodies. From donation masks, pharmaceutical supply to the international corporations, we are willing and have the ability to offer our helping hand to support our friends. Also, it's our honor to cooperate with India. Though the epidemic has yet, we still believe we can win this battle. Thank you for your participation and wish everyone the best of health.
Thank you so much. And maybe now have our guest of honor, Chuang Liang Shi, MD, PhD, Deputy Minister, Ministry of Health and Welfare, Taiwan.
Ladies and gentlemen, I'm Chuang Liang Shi, Vice Minister of the Ministry of the Health and Welfare. It's my great pleasure to give the opening address of the Global Healthcare Unity Summit. Taiwan government has been promoting new southbound policy since 2016, which calls for developing comprehensive, mutually beneficial relations with countries in the Association of Southeast Asia Nations and South Asia, Australia, and New Zealand. India is always listed a key country in all areas. This year, COVID-19 wreaked havoc worldwide. What we suffer are not just life's rules, but also in all dimensions. Taiwan is one of the few countries which have been able to contain the spread of the COVID-19 quite effectively. Taiwan, only 130 kilometers from mainland China, not only has numerous visitors from China, but also have many people working and studying in China. Even Johns Hopkins University initially predicted that Taiwan would be the one of the hardest hit countries in the world. However, Taiwan's aggressive measures have paid off and successfully keep the COVID-19 at bay. Here I'm sharing today is about how Taiwan fight COVID-19. As of now, the global confirmed cases are smashing through 30 million. In Taiwan, we have 509 confirmed cases and 7 deaths. This success is not coincidence. The Taiwanese government integrated data from the national healthcare system, immigration, and custom authorities to aid in the identification and the response to the virus. Government's efforts are all coordinated through the National Health Command Center of the Taiwan CDC, established to aid in disaster management for epidemics following the 2003 SARS outbreak. The 2003 SARS outbreak led to the loss of thousands of lives, which makes our government and the people on high alert at the early stage. Last December, when we heard of the contagious new respiratory illness began to appear in China, we started preventive measures. We established the Central Epidemic Command Center, implemented the border controls, and introduced the mandatory quarantine. After January 21st, when we had the first infected case in Taiwan, we started strict investigation to track the travel and the contact history of every patient, which helps contain the community spread. Taiwan not only enacted border control procedure, but also enacted relief measures to counter the economic impact. After its setup, Taiwan government also hosted press conference to report the situation to the public and use social media, YouTube, Line, new channels to emphasize the importance of sanitary and prevention methods of COVID-19, to educate the public honestly and transparently with public once a day. The government had implemented a ban on exporting face masks in order to ensure an adequate supply for citizens after the first case of COVID-19 was discovered in Taiwan within 3 days. Sale of masks was also strictly controlled in order to make sure every individual had access to them, without the people being able to buy and hold masks for private use. Also, we began a massive increase of production of medical masks, as well as sanitizing alcohol. In addition, we started rationing face masks and quickly established a national team for medical mask production. In addition to the public health professionals led by Health Minister, all our citizens have done their part, such as the wear face mask, monitor body temperature, keep social distance, and maintain hand hygiene. This is a partnership we call Team Taiwan. COVID-19 is a global level disaster which requires a joint efforts of all countries. Despite the lack of the official diplomatic ties between Taiwan and India, both countries set up representative office in each other's respective capitals in 1995. Since then, we have engaged in dynamic, ongoing communication on many levels. For example, in this epidemic, Taiwan provided surgical masks to India in support of frontline medical personnel. Taiwan's researchers at Academia Sinica announced they have synthesized over 100 milligrams of the remdesivir. It took the team, which includes 2 members from India. Also, National Cheng Kung University Hospital, Taiwan have been sharing experience related to COVID-19 information, including testing methods, treatments, approaches to containing infection, and measures concerning masks. Over 10,000 medical personnel in India benefited from these webinars. Taiwan has one of the world's top healthcare systems and strong research capabilities. Although Taiwan is unfairly excluded from the WHO and the UN, we are still willing to share and collaborate with the public and the international bodies. Over the past months, we established a national team. Now, we must take part in a global campaign and work together with other countries to set up a zone defense and comprehensively prevent the spread of this virus. No one can isolate a friend who genuinely wants to help. Out of the humanitarian concern, Taiwan cannot stand by while countries are in dire need of assistance to stop the spread of the virus. We are willing to provide assistance to the international community in 3 areas: face masks, pharmaceuticals, and the technologies. Taiwan will actively bolster our cooperation with other countries to prevent the spread of the COVID-19. In times of crisis, countries around the globe must unite, show solidarity, provide mutual assistance, and work together to fight the coronavirus. Taiwan is willing to exert its influence in this battle and join hands with the international communities so that we can overcome this challenge together. Taiwan can help, and Taiwan is helping. Here, I wish everyone good health and stay safe. Thank you so much.
Uh, Thank you so much. I would now like to ask our Brigadier Dr. Arvind Lal to please present the keynote address for the summit. Dr. Lal?
Thank you very much, Priyanka. So, can you hear me?
Yes, sir, we can hear you.
Can you hear me?
Yes, sir,
Okay.
loud and clear. Yes.
Fine. Okay. Thank you very much. So first of all, I take this opportunity to thank our hosts, that is VOA in Times of India, and especially Dr. Naveen Nishchal, Mr. Afzal Kamal, and Dr. Sachin Gupta. And I have the privilege of welcoming our illustrious panelists and speakers, who may not be here today, like Dr. Balram Bhargav, Dr. Chung Liang Shi, Mr. Alan Gemel, OBE, Mr. Navdeep Renwa, Mr. P. N. Ranjit Kumar, Dr. Verinder Garg, OSD2 Union Health Minister and President PGIMR, and Dr. Chi Sin Su, whom we just heard. So thank you very much, ladies and gentlemen. And I would like to say from the Indian point of view that life as we know has changed drastically, as over 32 million people have been infected by COVID-19 worldwide, which was declared as a pandemic about 6 months back. The outbreak's progression in India has been relatively slow. The fatality rate is also low, but we now have about 6 million cases. India took several proactive steps and channelized all its resources with concerted efforts made by stakeholders across verticals. India's 3Ts approach, that is test, trace, and treat or isolate, cluster containment strategy, and we saw one of the strictest 21 days lockdown and widespread communication about prevention and social distancing prevented the situation from getting out of control. In spite of some initial hurdles causing low rate of testing, we were able to quickly ramp up testing. We have reached the level of testing nearly 70 million samples for COVID-19 till date, and yesterday we tested 1.5 million samples. The overall testing capacity is estimated at 1.2 million samples per day, and this tantamount to India testing about 50,000 persons per million population. For this, I take great pleasure to inform all of you that this wouldn't have been possible had it not been for the sterling efforts made by the government of India, and especially Dr. Balram Bhargav, the DGICMR, who made India come up to this level in a short period starting from end March, when we had only 52 labs all over India. And today we can boast of more than 1,800 labs all over India, out of which 60% are run by the government and about 40% by the private sector. Limited availability of healthcare resources, medical staff, beds, and critical care equipment like ventilators and essential supplies like PPE and test kits posed a huge threat to India's preparedness. But the private sector healthcare providers were quickly roped in by the government to help expand testing and COVID bed capacity. Recalibrating export to critical items and quickly ramping up indigenous production helped control the situation. But healthcare administrators and workers had to bear the brunt of this situation, working with limited resources and risking their lives. Health being a state subject in India, state governments are aggressively fighting the outbreak with innovative solutions. Take, for example, Kerala, where the infection was first reported in India, was able to contain the outbreak quite effectively. Kerala relied on extensive testing and door-to-door contact tracing to limit the spread of the infection. Maharashtra and Karnataka were the first movers in demarcating dedicated hospitals to prevent cross-infecting other patients by treating COVID patients in regular hospitals. The dedicated hospitals were set up in a short span of time with the help of private healthcare providers pooling in their resources. However, different states in India and different countries across the world are at various levels of vulnerability when it comes to fighting this pandemic. The World Bank estimate suggests up to 71 million people across the globe have been pushed into extreme poverty in 2020. This will have long-term consequences for the human population. We are still in the midst of pandemic, and some relief is only expected once a vaccine is made commercially available or herd immunity is attained. At this time, leaders of the world and the health sector must come together to explore possible solutions and share best practices to minimize the impact of the outbreak. Countries need to bring forward their respective expertise to provide solutions for the world, especially in the health and human development sector. The private sector in India also plays a key part in responding to the multifaceted impacts of COVID 19 and in delivering national and global development priorities. India has already started its journey towards becoming a hub for the world for cost effective health solutions. Even before the pandemic, India was increasingly referred to as a pharmacy of the world. Indian India pharma exports have valued at approximately 18 billion US dollars. That too, with the prices of medicines in India are among the lowest in the world. The country has also emerged as a preferred destination for medical tourism, offering treatment at fractional cost as compared to developed nations. The industry is worth more than 3 billion US dollars. India also has a strong focus on augmenting its medical technology industry and recognized it as one of the sunrise sectors. We are famous for our frugal innovations, which have saved millions of lives in resource-strapped settings. In context of COVID-19, India is gearing up for mass-scale production of vaccines, the indigenous one being from Bharat Biotech's Covaxin, and then the Serum Institute of India and AstraZeneca's Oxford University developed Novavax, and India's biological e-manufacturer of the Johnson & Johnson vaccine. Therefore, I am optimistic that we shall see 3 vaccines in India by the middle of June next year. The Indian government has launched several aspirational initiatives such as Make in India, Digital India, Atmanirbhar Bharat, and Self-Sufficient India, and Ayushman Bharat, India's flagship health program. And being the second most populous country in the world, India's initiatives in healthcare provides a huge platform to forge global partnerships in healthcare that can help realize the vision of healthcare for all in all countries. No country or entity could achieve this alone. Therefore, it is crucial to involve governments, civil society, international organizations, and of course, the private sector. Global health partnerships, such as the Global Fund to Fight AIDS, Tuberculosis, and Malaria, and Gavi, the Vaccine Alliance, have helped several countries achieve targeted health outcomes in the past, and they continue to do so. Forums like the Global Healthcare Unity Summit, which are congregations of leading minds from different verticals of healthcare, that is policy, hospital, clinicians, medical technology, pharmaceuticals, diagnostics, technology, insurance, and others, are enablers of futuristic partnerships in the health sector. Thank you very much.
Thank you so much, Dr. Lal. It was a lovely address and a lovely note. And yes, it is really heartening to hear about all the developments that are happening. And hopefully, with all of us working in tandem, we will soon be over this piece and we will move into more happier and more healthier times.
Thank you.
I would now like to have the thank you note from Afzal Kamal, General Secretary of Voice of Healthcare.
A warm and graceful morning to esteemed Chief Guest, Management Committee, ladies and gentlemen. The main objective behind this Global Healthcare Unity Summit organized by Voice of Healthcare and Times of India. International Interactive is solidarity with global healthcare ecosystems, policy programs, and trade cooperations domain in turbulent pandemic times. In this 2 days summit, expert speakers have shared his experiences and thoughts. To combat COVID scares in doing business, I would like to thank our chief guest, Dr. Balram Bhargav, keynote speakers, visitors, and exhibitors. Many thanks to country partners Great Britain, Taiwan, and Israel. Last but not least, I would like to express my gratitude to Team VOH and TOI. Thank you so much for your support.
Thank you so much,